I'd now like to welcome Jodie Thompson. Jodie is an experienced clinical nurse consultant of over 26 years. She spent most of her nursing career in the pediatric disability, working in pediatric disability, including spinal cord injury. And in 2003, led the development of the Paediatric Outreach Service in the tertiary pediatric hospitals in Sydney. So Jodie now leads the Kids Collaborative, a pediatric nursing service. So Jodie provided feedback as a healthcare professional into the development of the SCI Healthcare Transition website. And she's going to tell us a little bit more about the work she does and her experience in this area.
Great, thanks, Emily. Now I have to apologise. My son has gifted me with COVID this last week, so I apologise now for the husky voice. I've been very excited to be a part of this project. It's something that has been many years coming to fruition, and I think this has been just the most wonderful development and stuff for people with spinal cord injuries and how we can support our young people moving between paediatric and adult healthcare services. As Emily was saying, I actually finished up at the Children's Hospital in December last year, and I'm now working privately in the community. But I'm just going to reflect on some of from my health professional experience about kind of being involved with people with spinal cord injuries in that paediatric system for the last 10 years. Actually, it's probably like 13 years now, as a clinical nurse consultant for outpatient spinal cord injury is kind of what my role was. And within the pediatric system, there's actually not that many pediatric clients coming through with spinal cord injuries, unlike with the adults. And so we have, maybe 14, 15 clients who are new clients that are coming through each year and things. So we have about on average about 5-6 clients that might be transitioning every year onto adult services. The discussions around how we used to do transition and things like reflect back to about 2009 when we noticed that there was a lot of clients that weren't making it to the adult health services. We might have been having conversations about, where you're going to be transitioning to and what we're going to do maybe in that last year or two prior to that transition. But often those conversations and things were very much, you just go see the adult doctors. Here's your referral, go and see them. It was a bit of a mystery and a bit of a leap for people to kind of go from this being a very supportive pediatric environment where you would be offered appointments every year or every 6 months or so. By the time that you left pediatric services, you might only be seeing once or twice a year. So that opportunity to be able to do some intensive sort of work around independence and things like that very much used to fall, I suppose, to a lot of the Paediatric Spinal Outreach Service who used to work closely with the kids about how we can kind of help them to get a little bit more independent with some of the skills that they required to be able to engage, I guess, with adult health services. And it was only until we started talking to some of these young people who had moved on to adult health services, we realized some of them fell away from all health services. And again, as Emily was saying about, they often got readmitted with complications to the adult system. So we questioned about how can we do these things better? So it was in about 2009 that myself and representatives from the Paediatric Spinal Outreach Service and Selena Rowe, who now is the General Manager of Royal Rehab, she was actually the manager at the time of the Spinal Outreach Service, the adult service. And we had conversations over Tim Tams and coffee at the time, I do recall, about how we can improve this process. So the three of us, Mareika McPhail, who used to be the physio on the Paediatric Spinal Outreach team, Selena and myself went out to see a lot of the adult services and actually speak to them about how we could improve that process. So the conversations around this stem from a long time ago and eventually led to the development, along with consultations across with our Randwick counterparts, our John Hunter. We spoke to the actual transition network, ACO, which used to be GMCT at the time. And eventually we did come up with a flow chart, which you may have seen along the way. I don't know. You can't probably see it. Like the backgrounds and stuff. That style, anyway. it was a flow chart that actually kind of talked through at the different ages and stages about what sort of things we needed to start thinking about to better prepare our young people for moving on to adult healthcare services. And part of the things that were identified by the adults is like, the one thing you guys do terrible is trying to get the kids as independent as they can, not only with self-cares, but their ability to be able to have like their in the health literacy and being able to manage a lot of their potential for health conditions or complications about how you go to prevent that. The other thing they tell that was fed back is that discussing a lot more and support around sexuality and sexual health and things like that were lots of questions that were never really well discussed, I guess, in the pediatric services. So we went about kind of trying to make those conversations more apparent in our clinics. By the time the kids were about the age of about 16, we're starting to take them into clinics by themselves so that they were able to tell their own health stories and be able to identify their health needs, so that by the time they moved to like an 18-year-old, they could start to do that, and it was a less of a leap to go into adult healthcare services, and they could feel like that they could identify those needs and be able to seek help when it's needed. So very much moving from places where we would offer all that help to them to moving to a different mindset where they had to identify what they needed help with. And that was something that was a little bit of a change in mindset, I guess, throughout those kind of later teenage years and things. Also, just to mention in pediatrics, depending on the age of which the child or young person had their spinal cord injury, the family very much go into a nurturing mode of getting them through that process of getting used to their newfound life, of what differences that made. And so that very much that nurturing role, it extends all the way through to when they're kind of that late teenage years. So a lot of these children are actually quite protected by having their families do a lot for them. And so when they actually, we actually have to make a particular point of like, okay, you're now kind of 16, we want you to actually start to be able to do some of these things yourself. And it was really important for, I suppose now as part of our clinics and things, is that we're doing that a lot more. The discussions and things are very much directed towards the young person, getting them to identify their needs, and their parents are there for support. And so I think that over the years, definitely, we have made lots of great changes in regards to how we introduce that. There are support from, again, Trapeze, which is our transition service of the Sydney Children's Hospital Network. There's also transition coordinators out there from ACI, that if people get a bit lost and they're not quite sure who they need to go and see or where to source services, that's where they can kind of get in contact with the ACI coordinators and things. So that tends to work quite well. So this transition website that has been developed is just wonderful, can be used as a transition tool for clinicians. I know myself as a clinician in clinic, I would be looking to that website to actually go through with families, looking at with a young person going, this is where we're at the moment in our journey to adult services. And these are the things that we're going to need to start thinking about. And I think it's just been, this website is kind of like the dream of what I would see as an ideal resource for not only for young people and families, but actually for clinicians as well, to help lead those conversations about how we can support people better, young people better in moving. And also thinking about, which is what we're doing now, I guess, is that we're trying to encourage the young person to go and see their adult-based clinician, but still have one other pediatric appointment left to make sure that we've tied up all the loose ends. And I think that crossover now is working quite well. So we're just always thinking about ways in which we can do things better and improve that process. And it has been an evolution, but I think we're definitely moving in the right direction. And the importance of peer support and that development dean of your role within SCIA to actually help to support young people, I think has been an extremely valuable role and things in helping to support young people through this process. So congratulations, Emily. I think this is a wonderful site. And I think that not only is it useful for people with spinal cord injuries, I think this will have lots of flow-on effects for people with all different conditions. This is not just for spinal. I think the elements of this website will be very useful for many different conditions. So congratulations. I think this is wonderful. And thank you for allowing me to talk today.